guys, I wanted to do a video for you on your Joint Commission book. So if you're looking at your menu tree, I'm in Module 3 and I'm in that first book entitled Joint Commission. Now remember, you don't have access to that unless you have completed the quiz, and then the restriction will be lifted. But on the first page there is a video presentation. It's just a short one that talks about what Joint Commission is if you aren't familiar with who they are and what they do and how they impact patient care, and kind of what the role is of hospitals and providers as far as the relationship goes with Joint Commission. So I'm not going to open that here. I'm going to trust that you've kind of taken a look at that video. If we go to the next page, it's a lot of facts about who is the Joint Commission, and we've already talked about what's the difference between accreditation and certification. And so what you know about Joint Commission so far is that they are the premier organization that accredits hospitals or institutions, and kind of what that does above and beyond the licensure in North Carolina. I can liken it to them getting a gold star. Look at us, we're doing extra to show our patient population that we are following different, more stringent standards to guide and administer our care. So that is exactly why they choose to be accredited. It also shows the healthcare consumer, again, that they're doing extra by following these standards to be accredited. And then they go into what's the difference between accreditation and certification. And when you watched your intro video, we did a little bit of that. But accreditation and certification, based on how Joint Commissions uses them and their definitions of that. Down here under what are the accreditation programs, I really don't need you to memorize all of these accreditation programs. Obviously, this one, the Hospital Accreditation Program, is the one that we're going to primarily be dealing with because that one directly affects us. But please note that what this means is that if you worked in behavioral health or you worked in long-term care, that your facility can seek accreditation from Joint Commissions just like a hospital can. And again, they talk about disease-specific certification programs, and those are individual programs, like I mentioned in my intro video, that, here we go, they can have a certification in asthma treatment, or they can have a diabetes center, or a heart center, or a stroke center, that they are working towards getting certification in, so they can market it and advertise that, hey, we're doing a little bit extra to receive this certification, and so that you know when you choose us for your care when you're having a stroke, we've gone above and beyond the regular healthcare facility. And then they list some benefits for patients, which I'm sure you read through. So we'll try to click to the next page. My internet's slow today. All right, so the accreditation process, let me tell you that this process strikes fear into hospital administrators. It is a process that is a total hospital process, so it's not just responsible at the administrative level or a supervisor level. It is down to every employee in the facility. And so that process, if you take a look right here, the process seeks to help organizations identify and resolve problems and to inspire them to improve the safety and quality of services provided. And that's exactly what they're doing. It's a continuous quality process. You'll have a whole class in your last semester with us called Quality Management. And we talked some about Joint Commissions again there too, and a little bit more in depth about what facilities have to do to remain accredited. But in any event, how do they measure how you're doing? Well, they've got standards. So right here in 2009, Joint Commission implemented a robust process improvement that allows us to target our own processes that need improving. And so a facility can determine what they are actually going to be evaluated on based on what they identify as deficiencies or possibilities for problems in their own facility. The survey process, if you take a look at it, it's designed to be individualized to each organization, consistent, and support the organization's efforts to improve performance, because at the end of the day, that's what the facilities are looking to do, is to improve the particular performance of their facility. So you're going to notice some words right here: tracing the care delivered to patients. Now next week you're going to find that I'm going to open some information about tracer methodology, sentinel events, national patient safety goals. You'll see all that pop up, and that's a little deeper into joint commissions and the programs and services and the standards that they're requiring their facilities to be measured by. So tracing the care delivered to patients, and we're going to talk about tracer methodology in just a minute. Verbal and written information provided to the Joint Commission, and I want you to think about a report, and we'll talk about what different kinds of reports those are in just a minute. But verbal and written information provided to the Joint Commission from the facility. Also, what they're going to be looking at is on-site observations and interviews by Joint Commission surveyors. And then while they're there on-site at the facility, they're also going to be looking at documents provided by the organization. Now, you may only see 4 bullets, but let me tell you, that is a lot of work in those 4 bullets for your facilities to remain accredited. Accreditation decisions are just that. It's after they've gone through these 4 bullets: tracing the patients, information provided, their site visit, their document review. What accreditation decision did they come up with? If you've already completed the first assignment in this module, which is the quality check assignment, you may have seen where your facility that you looked up has their most recent accreditation decision listed and what that means for them. Expectations of accreditation. An organization's accreditation cycle is continuous. That's a key word I want you to remember. It doesn't mean that your facility gets ready for a Joint Commission survey and once they pass it, they go, whew, I'm done, and I don't have to deal with Joint Commissions for another couple of years. It's continuous. It's called continuous quality improvement. And when we look at the reports that are required to provide to Joint Commissions, it'll make a little bit more sense. Alright, so the next page, a little bit of facts about hospital accreditation. You've got eligibility, benefits, and then the different standards. We're going to look at this because also I'm going to provide to you some information about specifics on hospital standards as it applies to health information. We're going to look at a few standards and break those down and try to understand what they look like. And so these bullets represent individual chapters within the book, and in those chapters there are standards, multiple standards that the facility must meet. Then you've got a little more information on the survey process. You'll see that a team is coming to your facility and can include 1 or more healthcare professionals, and specifically you're going to have an MD and most times a nurse, and then that 3rd or 4th member, depending on how big your facility is and the work that needs to be done, you're usually going to grab a hospital administrator or another clinician to be on that team. And here again are those 4 bullets. If you're seeing it again, don't you wonder if that's important to know? So the survey process again involves these 4 bullets, and your team that visits your facility will be working through those 4 bullets while they're at your facility and prior to. The next area talks about performance measure requirements. And so there's a lot of information in here, and it talks about the Center for Medicare and Medicaid Services. And remember, we talked about in the intro video deemed status. That deemed status that relates to the Centers for Medicare and Medicaid Control deals with these performance measure requirements. And so if you're meeting them for Joint Commissions, you're meeting them for the Center of Medicare and Medicaid Services. And so that's what that paragraph is pretty much explaining to you at this point about what performance measurements are and how the two organizations work to align themselves to be kind of a one-stop shop. Information available to the public. Well, look there. There's quality check. That's, if you haven't taken a look at it yet, that's your first module assignment, is quality check. And then here is an idea. Obviously, it's a little old, 2010, but it gives you an idea about how much accreditation is. Take a look at that. So depending on the size of your hospital, remember, they're just given a ballpark, but it's quite a bit of money for your facility to remain accredited. I'm going to stop right here and start another video for the rest of the book. Thanks.